I'm Nima Rajan, and this is Forum Daily Week in Review. The Royal Canadian Legion has chosen the mother of the last Canadian soldier killed in Afghanistan to be this year's Silver Cross Mother. Candy Greff of Alberta will lay a wreath at the National War Memorial in Ottawa on Remembrance Day. This will be on behalf of all mothers who have lost children in service to Canada. Master Corporal Byron Greff was working as a military trainer when he was killed by a suicide bomber in October of 2011. He was Canada's last military fatality in the country before Canada's mission in Afghanistan ended in 2014. Well, with us now to unpack this and the Royal Canadian Legion's Poppy campaign is Mr. Danny Martin, who oversees the National Silver Cross Mother appointment with the Royal Canadian Legion. Mr. Martin, welcome to Forum Daily.
Thank you. Glad to be here.
So take us back to when the Royal Canadian Legion started the Silver Cross Mother tradition and how it goes about.
Well, basically, it starts back in 1936 with the unveiling of the Vimy Memorial in France, and the first Silver Cross Mother that was selected was Mrs. Wood from Winnipeg, who had lost two sons in the Great War. From then on, it has carried on that tradition right through to this particular day, and the selection process is done through the Legion, through nominations, and several other criteria.
So tell us a little bit more about this year's Silver Cross Mother, Candy Greff, and why she was selected.
Mrs. Greff actually is a bit of a rarity. He was nominated by her Legion branch in Lacombe, Alberta, and that was 5 years ago. So basically, we have a big selection of Silver Cross mothers, unfortunately, meaning that they have to be a Silver Cross mother because your son or daughter has died in the service of their country. So there's many nominations made. We keep them on file until they're selected. And then based upon a review of a committee over the years, we look at what arm of service they were in, what province they're from, what conflict they were in, and then based upon those criteria compared with provincial locations as well, then we make a selection based upon that.
Now, we'll be sure to watch out for Miss Greff on Remembrance Day. Now,
Yeah.
this Remembrance Day itself is quite unique. It's the first one under King Charles and the 80th anniversary of the Dieppe raid. So how would these
Right.
anniversaries impact the Remembrance Day ceremony this year?
Well, not so much with King Charles. We're actually paying tribute to Queen Elizabeth II on her passing. She was a veteran of actually the Second World War. So at the National Monument, there'll be a wreath placed in front of the monument, pre-placed in honor of Queen Elizabeth II. And basically, for the 80th anniversary of Dieppe, we have a flag that was brought up to us from a long story that comes from the United States, that a soldier had been carrying it on the day, on the 19th of August, 1942, and we'll have it displayed on site. Now, this flag, we don't know who carried it. All we know that a German soldier in the burial detail after the battle had happened had discovered this flag, kept it as a souvenir, discovered by a American soldier who had, the German was in a POW camp in 1945, relayed the information that he had taken it from a Canadian soldier from Dieppe, and then over a long period and a whole bunch of other different circumstances, it ended up with the Legion. And so it's an artifact that we want to place out there, an unknown, for the unknown soldier tomb, being an unknown soldier who carried this flag into Dieppe, a horrendous raid and a loss of life for Second World War casualties.
All right, Mr. Martin, about a minute and a half left here, but the Legion is also conducting its Poppy campaign. So tell us a little bit more about this year's Poppy campaigns, the new biodegradable Poppy, and where the funds raised from this Poppy campaign will go towards.
Right. Well, the last Friday in October is when the Poppy campaign begins and ends on the 11th of November at midnight, depending on what time zone you're in the country. Yes, there was a great demand, and the Legion was very careful to get a hold of biodegradable material, have it developed into a poppy that is durable but also biodegradable. So that's being filtered out into the market right now. That's going to take a couple of years to filter through because, of course, there's millions of poppies out there already in storage in Legion branches. But it's also it is happening. There's also the digital poppy that a lot of people in a digital format donate and get a digital poppy in support of veterans and their families across the country. So those are two elements. And there's another special one also, that the poppy now has a program where you can like a URL code, and you can snap it on your own poppy, and it shows up as on a certain site an individual war story from, or the personal story of someone that served in battle for Canada. The Poppy funds themselves go across the country. All Legion branches distribute them to veterans in need and their families. And there's also funds at the national level for major programs for OSI research and so on.
All right, Mr. Martin, thank you again for joining us today on Forum Daily. A two-day meeting between all 13 of Canada's health ministers and their federal counterpart began in BC today. Federal Health Minister Jean-Yves Duclos is expected to hear the ministers' call for additional funding and supports. This comes 4 months after Canada's premiers met in Victoria last July to ask Ottawa to increase the Canada Health Transfer. Provincial health officials continue to show a united front of frustration over what they call a crumbling healthcare system. All right, well, joining us now to talk more on Canada's struggling healthcare system and what needs to be done about it is Mr. Stephen Staples, the Canadian Health Coalition's National Director of Policy and Advocacy. Mr. Staples, welcome to Forum Daily.
Thanks for inviting me.
So a lot's been thrown at Canada's healthcare system throughout the past 2.5 years, sir, from the peak of the pandemic, a mental health crisis, a toxic drug crisis, so much being thrown at the healthcare system. How is it functioning right now?
Well, we're not out of the crisis yet, and it is hard to understate the results of the pandemic. We've lost so many healthcare workers from burnout that's increased wait times, and there's still issues of funding. And now we have some provinces talking about going more to the private sector, which is quite alarming to a lot of people. So there's no shortage of issues for the provincial and federal health ministers to be talking about this week.
No shortage of issues indeed, sir. Now, ministers are calling for additional funding, we mentioned, but this is not the first time that officials have asked for financial support in the health sector, particularly when it comes to the Canada Health Transfer. So how has Ottawa reacted in the past to these requests?
Well, you got it. The Canada Health Transfer is the big bulk of money that goes from the federal government to the provincial government for healthcare. It's over $40 billion and it's tied to inflation, so it goes up. So as inflation goes up, so does the amount of money that goes to the provinces. Now, the provinces complain that the amount is not enough and that they shoulder way more in terms of a percentage of public healthcare costs than the federal government has, and they want more. The federal government has been saying and continues to say, we're prepared to give you more money, but we want to see outcomes. We think it's reasonable to ask, what are you going to do with it? Will Canadians actually see an improvement of healthcare if we give you more money? The province's response has been, butt out. Healthcare is our responsibility. Just write us a blank check. And there you've got the standoff between the federal government that will give money but wants better outcomes, or at least to know what the outcomes are. And the provinces are saying, give us the money. We know what's best. Trust us to do what's right with provincial healthcare programs.
And we know the provinces are pushing for a meeting with the Prime Minister regarding the Canada Health Transfer. So how do you expect health ministers to achieve this goal through this week's meeting with Jean-Yves Duclos?
Well, we're looking for any kind of thawing or any kind of progress with Jean-Yves Duclos. I did notice that BC Health Minister Adrian Dix, who's chairing the meetings for these 2 days, did seem to distinguish between his relationship with Jean-Yves Duclos, the health minister. He's from Quebec City. He's an academic. He's quite approachable. And he seems to have a better relationship with Duclos. And he contained more of his chagrin, I would say, for the Prime Minister himself, pointing more fingers at the Prime Minister. So I think Jean-Yves Duclos is going to this meeting. It's the first meeting of its kind since the beginning of the pandemic. And hopefully he's going to find at least maybe even some non-monetary ways that they can work together, get the information sharing, data gathering, something like that, to begin to build the relationship. And then some money discussions will come later on. But there's still a lot of work left to be done.
Lots to keep our eyes on. A quick minute left here, Mr. Staples. But in addition to funding, what kind of additional supports and measures are health ministers going to be calling for?
Well, I think that's going to be primarily what they're looking for. They're looking for funding. They want to keep healthcare under their own purview, so they just want Ottawa to foot the bill. Certainly, Ottawa will be looking for outcomes, especially new programs. We have a dental care program that's coming online as a result of this phenomenal agreement between the NDP and the Liberals, which is delivering new healthcare programs. So pharmacare is coming down the line, which will impact provinces to some degree. But also, we've been looking for a national pharmacare program so that people can have the cost of their prescription medicine covered, and so it's not dependent on whether they've got private insurance or a big credit card balance available or anything like that. That drugs should be covered under our national program, and we'd like the federal government to pick that up as well. So we hope that that'll be part of the conversation.
All right, Mr. Staples, thank you again for joining us today on Forum Daily.
My pleasure.
A hopeful two-day meeting between provincial health ministers and their federal counterpart came to a disappointing end yesterday. The federal government has withdrawn from a joint communique on health funding with provincial and territorial ministers. Now, this ended 2 days of widely anticipated meetings in Vancouver without any agreement. Federal Health Minister Jean-Yves Duclos blames the premiers for releasing a statement that he says depicted the talks as a failure. Now, he says this forced their ministers, quote, to think of one thing and one thing only: money. BC Health Minister Adrian Dix made it clear that he and other provincial and territorial health ministers were united behind a request for federal funding to be increased from 22 to 35%. Now, meanwhile, healthcare systems across the country are dealing with issues including staff shortages, overwhelmed hospitals, mental health issues, and new virus variants. Well, joining us now to give us his perspective amid all of this is Dr. Abhishek Raut, Medical Director at Apple Tree Medical Group. Dr. Raut, welcome back to Forum Daily.
Pleasure to be here.
So, what is your take on the health minister's meetings with Federal Health Minister Duclos?
Well, I think we had a golden opportunity for the federal and provincial health ministers to really look and advocate for Canadian healthcare, and even help the 1.3 million healthcare workers from coast to coast. I think we were hoping this meeting could really chart a clear path to a tangible action plan and help rebuild some of the struggling healthcare systems that we've been having. Unfortunately, it didn't get to where we wanted. There are some positives for it, though. I think the health ministers definitely understood the issues, and sometimes in politics, that is the biggest problem. So at least everyone is on the same page in terms of priorities and concerns we're facing. Remember, this is also the first meeting they've had since 2018 in person. So is there a lot more work to be done? Absolutely. Is it going to be solved in 2 days at a conference room in the Pan Pacific Hotel? Probably not.
Now, on a personal note, how are you, your colleagues, your employees faring in what some health ministers are currently calling a crumbling healthcare system, Dr. Raut?
Well, to me, I would have to agree with my colleagues at the Canadian Medical Association and the Canadian Nursing Association that it's very clear that Canada's health system is not really working the way it should. We're seeing doctor and nursing shortages, and the healthcare crisis is having very detrimental consequences to our system. And people are losing confidence when they are concerned that they may not be able to access those critical health services. I think now what we have to do is really focus on that communication and coordinated piece to really overcome those challenges that we have.
Now, as we mentioned, there is no shortage of issues hitting the Canadian healthcare system, Dr. Raut. So, what has been your primary concern amid all of this? What's been hitting you the hardest right now?
Well, my primary concern here is really about our patients. I think it's very clear to everyone, even at the conference, that Canadian patients and caregivers are really continuing to suffer. So we're having healthcare providers who are burning out and leaving their professions. We're seeing wait lists that are growing rapidly. Emergency departments are closing due to staff shortages. So I think we're all deeply concerned about what that means for Canadian healthcare, but also for the average Canadian who's a patient and a caregiver as well.
Deeply concerned indeed, Dr. Raut. Now, we mentioned health ministers are asking for an increase to the Canada Health Transfer benefit. So, can you tell us a little bit more how that would benefit your own practice, your staff, and your patients?
Yeah, it's a difficult question. I have a bit of background in health systems, so when I look at this situation, I think the health transfers would be a good start, but I don't think it would necessarily fix all of these problems, even if the transfers went to 100%. I mean, these are structural issues that we've got to focus on: health system strengthening and accountability. Accountability meaning federal, provincial, territorial accountability, physician accountability, and patient accountability. So I think there's a big conversation here that we have to look at what the future of healthcare is going to be in Canada.
Right, Dr. Rao, just about a minute left here, but what's at risk here if the federal government does not take action on these supports?
Yeah, I think what we're going to see is if we don't really work together on this, everyone is going to suffer, especially the most vulnerable, our patients and caregivers. We're talking about serious system health challenges here that healthcare providers and organizations are continuing to have. We're going to need both short-term and long-term solutions here to really make a difference. And I think the Canadian Medical Association, the Canadian Nursing Association, and Healthcare Can have come up with a great policy piece called A Prescription for Hope, which is definitely worth checking out, which would look at some of those solutions there as well.
Prescription for Hope. Definitely have to take a look at that. Dr. Rao, thank you again for joining us today on Forum Daily. All right, up next, we were given a look at elections and misinformation ahead of the U.S. midterms, and a look at how some social media platforms compare to others when it comes to fighting misinformation. We'll have our interview with Dr. Dam-Hee Kim, communications expert and assistant professor at the University of Arizona. And after that, we'll have even more important conversations from this past week. So don't go anywhere. Forum Daily Week in Review will be right back after a short break. The U.S. midterm elections are set for tomorrow, and election security officials are expressing concerns over threats to the nation's voting systems. And the task of protecting those systems has become increasingly more difficult. That's partly because millions of Americans embrace unfounded conspiracy theories about supposed election rigging. Election officials are watching for harassment, intimidation, and even physical violence at polling places and elections offices. And making matters worse, global rivals are expected to deepen disinformation efforts. With us now to discuss the state of misinformation and disinformation as U.S. elections draw near is Dr. Dam-Hee Kim, Assistant Professor of Communication at the University of Arizona. Dr. Kim, welcome to Forum Daily.
Thanks for having me.
Now, security officials are expressing concerns around these kind of threats becoming more complex. So in what ways have these online threats evolved throughout the years?
Yeah, today misinformation comes in forms that are more appealing to people, yet are more difficult to be reviewed for its accuracy. So, first, more and more information is spreading in the forms of videos. So, these videos are more challenging to review than text based content. However, videos are more likely to be recalled, evoke emotion, and persuade people because they often come with attention grabbing images and sound. And relatedly, there are deep fakes, videos that have been manipulated to make false content look real, for instance. There are deep fakes of politicians and celebrities saying or doing things that they did not. And lastly, a lot of misinformation is produced not just in English, but also in Spanish or French, for instance. So misinformation is harder to detect when they are in subtitles, for instance.
Some very interesting and concerning information there, Doctor. Now, how do the different social media platforms stack up when it comes to fighting misinformation?
Yeah, great question. So, social media platforms such as Facebook Meta, Twitter, TikTok, and YouTube have largely three policies to fight misinformation. Often, by working with third party fact checkers, they first suspend users who are known to spread misinformation extensively. And second, they also flag posts containing misinformation, including false information about how and when to vote, for instance. And third, social media platforms try to reduce the visibility of misinformation using algorithms before they go viral. The thing is that their plans for dealing with misinformation in this year's US midterm elections are not very different from their 2020 plans. And experts have noted that their 2020 plans were not thorough enough.
And to add to all of this, there's concerns around disinformation from foreign powers, including Russia and China. So, can you tell our viewers the difference between disinformation and misinformation, especially ahead of the elections?
Yes. Misinformation and disinformation are both false information, but they differ by intention. So, misinformation is false or misleading information that results from unintentional inaccuracy. However, disinformation is false information intentionally designed to mislead people.
All right. And so, in terms of the voters watching us right now, both in the US and Canada, how can they differentiate and protect themselves against consuming or spreading misinformation or disinformation, especially during election periods?
Yeah, first, we can pay attention to the source of the information, specifically if the source is legitimate and has a reputation for good journalism and accuracy. So, in case you're not sure, you can consult fact checkers like FactCheck.org or PolitiFact, among others, when you come across potentially false information. Second, we can watch out for provocative headlines. We can read a little further before believing or sharing a story, and especially look for supporting evidence in the story. Also, one pattern we see is that some misinformation stories are recycled, meaning that they are dated and they are not relevant anymore today. So look for that pattern. And finally, we need to check our own confirmation biases too. So, as humans, we like to readily believe information that's in line with our own views, while we tend to discount information that we do not agree with. So, we need to try to stay objective and look for facts.
Lots to consider there. Dr. Kim, thank you again for joining us today on Forum Daily.
Thanks again.
All right, I'm Nima Rajan, and that'll do it for your look at important conversations from this past week. Remember, for more news on demand, you could always visit our website, thenewsforum.ca, and be sure to follow us on Facebook, TikTok, Instagram, and Twitter for updates. You can also watch all of our news and commentary programming on the News Forum YouTube channel. And stay tuned to our network for more news updates and in-depth interviews from a Canadian perspective. Thanks again for joining us on the Forum Daily Week in Review, and we'll see you again next time. Have a great weekend, Canada.